it's JT. Hope you're enjoying the holiday break. And while the regular team is taking some time off, we've got some great guests and lots of topics to cover. And right now, Dr. Fahmi Farah joins us now, who is a dedicated cardiologist and also the director of Bentley Heart in Fort Worth, Texas. Dr. Farah, thanks so much for being with me.
Thank you so much for having me. It's a pleasure to be here.
Absolutely. As a cardiologist, I mean, this is the time of year a lot of people are concerned about overeating, over drinking, overindulging, period. But a lot of people say, it's the holidays. Let's just go ahead and do this. But with that comes some consequences, unfortunately, sometimes. And I wanted to talk to you about something called holiday heart syndrome. What is that?
Holiday heart syndrome is something that happens over the course of between Thanksgiving and New Year's. So it includes Thanksgiving, Christmas, and New Year's Eve. Basically, what happens during this time is the rate of heart attack goes up by quite a bit compared to the rest of the year, as well as the rate of heart failure patients coming into the hospital. All those numbers are pretty high.
So is it because is it grandma's gravy that's doing this, or is it the alcohol, or too much pumpkin pie with whipped cream? What's the problem with this? Why does this happen?
It's a little bit of all of the above that you mentioned. During the holiday season, of course, the unhealthy diet is a huge part of it. There's a lot of butter, salt, so the sodium content goes up. That increases the risk of both heart attack as well as heart failure. Patients who have heart failure, if they have high sodium content in their food, they can go into acute heart failure and wind up in the hospital. And we see a lot of that during that time. And you mentioned alcohol. So alcohol consumption typically goes up during that time. And it does have an effect on binge drinking, does have an effect on our heart health across many different types of heart conditions, including heart failure, heart attack, as well as arrhythmia. Smoking, so all those unhealthy habits certainly contribute. You know, during holiday times, people tend to forget or get out of their routine. A lot of times they're traveling, so they don't exercise. They sometimes forget to take their medications, so compliance goes down. A lot of times they just don't want to, if they're having a little problem, they want to wait it out until after the holidays. And that can sometimes get them into trouble as well. Something that could have been prevented can end up being a heart attack. So all these things matter. Snow shoveling is a big deal as well. During winter time, there's, you know, in areas where it snows a lot, people have to shovel their snow out of their driveway, and that increases their metabolic activity a lot more than what they're used to typically, and that stress can cause somebody to have a heart attack as well.
Yeah, I do want to talk about that in just a minute. You had me at butter, though. We got to back up on that one. So when you talk about things like butter and ingredients we use during the holidays to enhance, like creams and butters and sugars and salt, a lot of that is not healthy for us. So let's start with butter. Is it better to use real butter and keep it real and just limit it, or go off to one of these side products that it tastes like butter?
Use real butter, but keep it moderate at little amount. I don't think there's any utility of using the side products, as you're mentioning, because they're not any healthier.
Yeah, I'd have to agree with that. Now, as far as cream goes, I mean, every ingredient in Christmas and Thanksgiving and holiday dishes, it seems, calls for at least a half a cup, maybe a cup of cream, and at least 1 or 2 sticks of butter. So you put the double whammy on, folks. All of a sudden, you're overloading, and your arteries are all of a sudden full of cholesterol. So if people are just careful and limited, the moderation is the key here, right?
Moderation is key, absolutely.
Well, when you talk about so much food, when people get into the hospital in problematic situations with an ambulance having to come to the home because of the overindulgence in food or alcohol or not being in shape and getting out there and shoveling the driveway, are there a greater increase in deaths because of heart issues, or are these just more heart issues that can be dealt with?
There are greater instances of death as a result of the heart issues during that time as well, from the heart attack and heart failure.
Now, back to the snow shoveler. I mean, I grew up in Pittsburgh. We were certainly well aware of the amount of snow we got every season. And we were out there as kids shoveling the snow. And I remember my dad being a smoker, and he liked his occasional cocktail every once in a while, but he'd be out there shoveling with us. Now, he was in his 40s and 50s when he was doing this, and we kept thinking, Dad, take it easy. We'll take care of this. So what's your advice for folks that want to get out or feel they have to get out and shovel the snow? Nobody else will do that. if they're not in regular shape and work out on a regular basis, this is not advised. It's pretty strenuous activity.
Yeah, for those who have risk factors and they're not routinely exercising or are not active, they're advised not to do snow shoveling during that time.
I mean, clearly somebody in the neighborhood who's 16 and wants to make a couple of extra bucks is available to get the snow shovel and come on over, right?
Right.
So what are some ideas for you when it comes to exercising during these colder months? I mean, even if you're living in Florida or California or Maine, this time of the year, it is colder no matter where you are. But in those areas of the country, the northern half of the country, there's a lot of other concerns that come into play because of the cold weather or being outside, right, when it comes to regular exercising.
Right. They do require to be outside more than some of the warm areas. The advice is, keep up with the exercise throughout the year. When that time comes, the winter time, which is, unavoidable, it's not an issue.
Is stress a factor during the holidays? I hear so many people get so stressed out and depressed because the holidays are here. To me, it's the most wonderful time of the year, as Andy Williams would say. But a lot of people, feel the added stress. Is that a factor in all of the heart issues as well?
It certainly is. Stress is a huge risk factor for heart disease, and we know, as you said, during the holiday season, stress is probably the highest for the year because of financial reasons and everything else that goes along with it. So stress management is very important to prevent these things as well.
How does holiday stress contribute to this holiday heart syndrome?
I think it is a contributory factor as well. With stress comes a lot of unhealthy habits as well. With stress, you're forgetting to take your medications, eating unhealthy even more, drinking, alcohol consumption usually goes up with stress, not able to sleep at night, all those things. So it's like a cumulative effect.
I mean, besides the obvious, cut back on food or just limit your food, try and maintain some exercise during the holidays. Well, what do you talk to your patients about, doctor, when it comes to cardiovascular health and the holidays when you're dealing with your patients?
The key advice is to make sure to maintain your daily routine of healthy eating and exercising, not to give up on those things, and to stay compliant with medications. A lot of times people forget to take medications during the holiday season. Also, if they're having any symptoms, not to wait until after the holiday, that they seek advice from their healthcare provider, their doctors, in a timely manner.
Do you find that's a pretty common thing for folks that, it's just a little pain here, that'll fade, that'll be okay? Do people tend to more neglect or get rid of their symptoms by just ignoring them, or people more apt to take it head on? Do most patients, for instance, say, it'll pass when they should be making a phone call?
They do, especially if they're having the symptoms on the day of the holiday. So we get a lot of patients coming into the hospital day after Thanksgiving, for instance, as opposed to on Thanksgiving. They'll just wait it out. So we do see that.
Yeah, so don't hesitate. Get on the phone if you think something's going on. Better safe than sorry, right? All right, one last question for you. New Year's resolutions, do they actually work? Is this good to relieve some stress?
I think it's always a good idea to have New Year's resolution. I have seen success stories with many of my patients. So I would encourage everybody to make a healthy resolution and stick with it.
All right. Dr. Fahmi Farah, happy holidays to you, cardiologist at the Bentley Heart in Fort Worth, Texas. Dr. Farah, thank you for being with me.